First of all, I welcome Dr. Ashutosh Kulkarni sir, President NIMA Central, Dr. U.S. Pandey sir, Secretary NIMA Central, Dr. Shantilal Sharma sir, Treasurer NIMA Central. Then I would like to welcome Dr. Kamini Dhiman ma'am, President NIMA OBGY Central, Dr. Priyanka Nakade ma'am, Secretary NIMA OBGY Central, Dr. Vishnu Bhavne sir, Treasurer NIMA OBGY Central, Dr. Rajesh Utane sir, Convener NIMA OBGY Central. I would also like to welcome Dr. Suhas Herlekar sir, President NIMA OBGY Maharashtra, Dr. Manoj Gaikwad sir, Secretary NIMA OBGY Maharashtra, and Dr. Ajay Raj Bal sir, Treasurer NIMA OBGY Maharashtra. Now, so before we go any further, let me give you few instructions that are common for all participants. Please keep yourself muted during this session. If your mic found unmuted or disturbing with the speaker's voice, you will be either kept in waiting room or removed from the session to maintain decorum of the program. If you have any questions, put your questions in the chat box or raise your hand. Now I would like to brief everyone here about our NIMA OBGY agenda. NIMA OBGY, that is National Integrated Medical Association, Obstetrics and Gynecological Society of India, aims to impart education in supporting and protecting the character, status, and interests of the integrated medical profession in general practitioners and practitioners of Srirog and Prasuti Tantra, that is integrated obstetric and gynecology in India. Our objective is to spread knowledge and to foster education in integrated obstetrics and gynecology, including human reproduction, family welfare, study and research in the field of contraception and other allied problems. NIMA OBGY is committed to promote services for betterment of health and community, especially maternal and child health, prevention of alignment and diseases, their treatment with integrated approach of Indian medicine with modern science. So with this, let us continue what we have come up today with you. This is our webinar in this series. So all of you, as you know, today's topic is Ayurvedic perspective of premature menopause. Premature menopause is one of the arising problems nowadays. So we are here to explore what Ayurveda has to say about premature menopause. Today we are very lucky to have here with us a very distinguished clinician, Dr. Mansi Modi ma'am. She will guide us through her novel thoughts regarding this topic. Hello. Hello. So we'll welcome you, Dr. Mansi Modi ma'am. We are honored to have you with us. It is my pleasure to introduce all of you, Dr. Mansi Modi ma'am. Dr. Mansi ma'am.
Yes.
Please
Hello.
welcome. Hello.
Yes.
With an inborn gift to excel and a strong passion for gynec medicine field, she pursued her BMS from Nadiad, Gujarat, and master degree in gynec surgery from IPGT and RA Jamnagar, Gujarat, India, which is the one of the best centers in the world. She has worked as HOD, Associate Professor in the Department of Obstetrics and Gynecology at the Parul University of Ayurveda, Vadodara. Currently, she is serving as a medical officer in the Gynec department at Government Ayurveda Hospital, Vadodara. She is ever willing to take up responsibilities and believe in discharging her duties with utmost dedication and care, having great experience of CCRAS thesis project on menopause syndrome from central government. With the God grace, she has solved more than 500 infertility cases throughout her career, more than 3,000 Uttar Basti procedure at OT, and more than 5,000 Virechan Karma as well as Basti Karma. She will guide us through her novel thoughts regarding this topic. Now, with due respect, I would like to call Dr. Mansi Modi ma'am to start this session on this topic.
Hello, Dr.
Dr.
Mansi ma'am.
Yes. Thank you very much.
Welcome, ma'am, and thank you so much that you are taking this webinar series as a first candidate
Yes.
from the youngsters ones for whom we are starting this series now. And we are
Okay.
privileged with your presence. And absolutely, this is like we are going to have the best knowledge regarding this Ayurvedic knowledge, basically.
Yeah.
And we hope to see a lot of other activities in such NIMA OBGY Society also. And you are
Yes.
definitely will be the part of it.
Yes. Sure.
Yeah.
Can I start now?
Yeah.
Yes.
Will,
Yes, ma'am.
yeah.
Thank you very much. Good evening, everybody. Respected dignitaries, my seniors and colleagues. Before starting this webinar today, I would like to special thank to my mentor, Dr. Kamini Dhiman Madam, who gave me such an amazing opportunity to present my views, my shares, my ideas, indeed my positive results on this topic with my case studies in front of you. There have been a pleasure in presenting this webinar, of course, to the august fraternities of doctors communities. It has been a very less interactions on this topic. So let us dwell in details on this unique subject with the topic of the Ayurvedic perspective on premature menopause. Why it is important current era, though the ratio is very low, but it is important in the era of infertility. Nowadays, due to change in lifestyle, psychological and physiological symptoms of early menopause are much pronounced and require much importance in international medicinal world. Why we should not adopt a hormone replacement therapy, as it may create endometrial cancer, loss of memory, allergic reactions, drug dependency, impaired motor functions, immobility, like that. What is this actually? Menopause is a natural phase in women's life, typically occurring around the age of 51. But for some women, this biological change begins earlier than expected, a condition known as early menopause. Early menopause, also known as premature menopause or premature ovarian insufficiency, refers to the condition where a woman's ovaries stop functioning before the age of 45. Women stops having menstrual cycles and can no longer conceive naturally, which typically occurs between the ages of 45 to 55, with the average age being around 51. What is early menopause and premature menopause? Early menopause occurs before the age of 45, but after 40, while premature menopause happens before a woman reaches 40 years of age. What is premature ovarian failure? Amenorrhea due to cessation of ovarian function before 40. First, primary amenorrhea. Second, secondary amenorrhea, which includes amenorrhea for at least 3 months, raised FSH and LH level, and there is always the deficiency of estrogen. This is the WHO classification of ovarian insufficiency. You can see here it is divided in group 1 to group 7, from hypothalamic pituitary failure to amenorrheic woman with space occupying lesions. What should be the clinical presentation of these kind of symptoms? In primary premature ovarian failure, there may be the signs or symptoms like primary amenorrhea, no pubertal changes. Of course, there is absence of sexual maturation, reduced growth velocity. In more than 50% of cases, there is ovarian dysgenesis. While in secondary POF, there is secondary amenorrhea with hot flushes and sweating, with diminished libido. There may be the vaginal dryness and urinary symptoms, and osteopenia as well osteoporosis with infertility. Permanent cessation of menses for 1 year and physiologically correlated from the loss of follicular function. Amenorrhea with sign of hypoestrogenemia and an elevated FSH and LH level. Various symptoms like hot flushes and other acute symptoms are associated with this condition. It is the counterpart of menarche. Counterpart of puberty and is a transitional phase of 1 to 5 years during which the genital organs involutes in response to cessation of gonadal activity. Causes of cessation of menstrual cycle. The menstrual cycle ceases due to the disappearance of all primary oocytes, which is an aging effect. So regardless of whether menopause occurs early or prematurely, the bodily changes remain the same. Both involve the cessation of menstruation, decreased production of hormones such as estrogen and progesterone, and the inability to conceive naturally. Let's have focus on causes of premature menopause. First of all, premature ovarian failure is a condition where the woman's ovaries stop producing eggs. In this case, immature eggs might be produced. This condition leads to premature menopause. Studies also show that women with epilepsy often have premature ovarian failure leading to early menopause. आज ही मेरे पास ऐसा सेम टू सेम केस आया था. I will discuss later on. Ditto this case. This is the condition of early menopause with epileptic case. Second cause is an autoimmune disease. Is a condition where the body treats its own tissues and organs as foreign bodies and attacks them. This disease could adversely affect the functioning of ovaries, leading to premature menopause. Some lifestyle disorders like diabetes, chronic backache, obesity, infertility, cardiovascular diseases, and anxiety lead to the premature menopause. Of course, in obesity, there is a bad for overall health. A healthy BMI with optimum weight actually supports estrogen production, as estrogen is stored in fat cells. The another important cause is chromosomal defects, particular with trisomy 13 and trisomy 18. Of course, we should not forget Turner syndrome is characterized by missing or incomplete sex chromosomes, which also contributes to the immature or unhealthy development of eggs. Another factors which affects this condition, that is genetically factor, affect chemotherapy and radiation therapy effects, as well hysterectomy and oophorectomy effects. These are the early signs we should also note while patient coming to our OPD. That is the changes in menstrual cycle, either irregular or stopped. Hot flushes, particular night sweats. Again, night sweats, vaginal dryness, decreased estrogen levels can lead to this condition. Mood swings, of course, irritability, anxiety, and depression is there. Difficulty in sleeping and decreased libido. Sexual drive is another sign of early menopause. So, early menopause and its implications are ovaries do not produce eggs, estrogen levels fall, no periods and no pregnancy. So these are the vasomotor symptoms: hot flushes, mood changes, depression, sleep disturbances, and fatigue. I'm also seeing all these conditions in 28-year-old my patient, which I will discuss later on. These whole vasomotor symptoms I have found in all my patients in early menopausal conditions. Of course, urogenital symptoms with dryness of vagina, dysuria, urinary leak, urinary frequency, or sexually problems. Musculoskeletal problems like sarcopenia, weakness of muscles, joint pains, osteoarthritis, as well porosis. While menstrual irregularities, unintended pregnancies, palpitations, low backache, dryness of skin, hair loss, eye problems, gum and teeth problems are also there. This is important. The role of stress in triggering early menopause, that is the first symptom, and my treatment will started on this base only: stress. Stress, both physical as well emotional, has been observed to play an important role in the onset of early menopause. Chronic stress can disturb the delicate balance of hormones in the body, including those responsible for reproductive functions. Health impacts and risk of early menopause. Estrogen plays a crucial role in many bodily functions. It protects against heart disease, supports bone health, and helps in maintaining skin elasticity. Early depletion of estrogen can increase the risk of certain health issues such as heart disease, osteoporosis, and certain types of cancers. Early menopause can also impact mental health, contributing to feelings of depression, anxiety, and lower self-esteem due to the premature onset of menopausal symptoms. So, health risk of early menopause are fertility issues, bone health, cardiovascular health, and mental health. Weight gain and other health issues associated with early menopause. Weight gain is common during menopause, and early menopause is no exception. Hormonal changes can alter the way your body distributes fat, leading to weight gain, particularly around the abdomen. Furthermore, with this, women experiencing early menopause might also face an increased risk of other health issues with weight gain, like vaginal dryness, urinary problems, and sexual dysfunctions, as well as sleep disturbances due to the frictions of thighs, due to the overaccumulation of fat. See, these are the long-term problems like heart disease, osteoporosis, Alzheimer's disease, arthritis, diabetes, hypertension, hearing and vision related problems. This is more prone, we have discussed previously. In this slide, you can see here in our left side that is normal ovary functioning, in our right side that is premature ovarian insufficiency ovary. So what normal ovary do? In normal ovary function is there may be the development of primordial follicles which convert to primary follicles. Hello. Which further convert to pre-antral follicles, which further convert to small antral follicles, and finally the stage reaches to the pre-ovulatory phase and ovulation takes place and corpus luteum development there may be. But in the cases of POI, premature ovarian insufficiency, there may be the stop of these all functions due to the atresia of these conditions, and results in the number of primordial follicles are exhausted and ovary totally stop functioning. So basically, there are the impairments in two roots, in brain, in hypothalamus, and in uterus, in ovaries. In hypothalamus, there may be the desynchronized gonadotropin hormone secretions, which may impair the FSH and LH level increases and lead to the loss of menstrual cycle. While in ovary, decreased in ovarian follicle mass and function, and estradiol fluctuations and decline in anti-Mullerian hormone and inhibin B can lead to the loss of menstrual cycle. So, what is the diagnosis and initial evaluation of primary ovarian insufficiency? Menstrual irregularity for at least 3 consecutive months with FSH, LH, and estrogen levels can be carried out at least for 1 month apart. There may be the 2 random tests at least 1 month apart, with the level of prolactin and thyroid function tests also. And if it is confirmed, then we should go for other karyotypes like immunological tests as well pelvic sonography. What we have found in investigations, of course, there is rise in FSH and LH level. In maximum cases, it is around 40 or just near to 40. Estradiol level is less than 20 picogram per ml. In karyotyping others, there may be impairment. Thyroid function test may be disturbed. Calcium level goes down. Blood sugar may also fluctuate. In USG, there may be the small ovaries with no growing follicles, and sometimes ovarian cyst is also shown. This is important. These 4 steps, I have put these slides particular. Why it is important? Because we have to reach to the particular diagnosis. कौन सा पार्ट डैमेज है, एंडोमेट्रियम डैमेज है तो उसके अकॉर्डिंग हम आयुर्वेदिक ट्रीटमेंट करेंगे, या फिर हाइपोथैलेमस डैमेज है, पिट्यूटरी वर्क नहीं कर रहा है, ये कैरिड आउट करना जरूरी है बिकॉज टू चूज द लाइन ऑफ ट्रीटमेंट. First of all, progesterone challenging test. After giving progesterone of 21 days, if bleeding occurs, then it can lead to the intact HPO axis as well adequate estrogen levels and responsive endometrium. But if bleeding does not occur, it can lead to the lack of progesterone receptors and diseased endometrium. Step number 2, combined test, estrogen plus progesterone. If bleeding occurs after giving that, then it represents a responsive endometrium with inadequate estrogen. If bleeding does not occur, it represents at endometrial lesion and HSC should be carried out in that cases. Number 3, serum gonadotropin estimation. If serum FSH is greater than 40, it represents a premature ovarian failure and resistant ovarian syndrome. If FSH is less than 40, it indicates as primary pituitary dysfunction as well secondary pituitary dysfunction. Step number 4, GnRH dynamic test. GnRH administration, after GnRH administration, if rise in pituitary gonadotropins, it represents as hypothalamic dysfunction. But if there is no rise in pituitary gonadotropins, that it may indicates the primary pituitary disorder. So in modern, what is the management? We all know that they have only hormone replacement therapies, conjugated equine estrogens, serum estrogen receptor modulators, antidepressants, gabapentin, blood pressure medicines, etc., enzymes and sedatives. Particular, they are using hormone replacement therapy to minimize the postmenopausal health hazards, steroids to prove autoimmune diseases, and in infertility cases, there is the one and only options IUI or IVF. What to do and what not to do? As a part of treatment, we should focus. What to do? Observance of personal, dietary, seasonal, social, and psycho-spiritual conduct, good food and adequate exercises, adequate rest, timely containment of health issues. What not to do? Keep away from stressful indulgence, erratic food habits, heavy physical work, addictions, and social insecurities, etc.
Psychological stress can lead to problems with the relationship and other sexual problems.
Hello?
I request everybody to mute your mic.
Now coming to our portion, that is Ayurvedic review. What Ayurveda says regarding this particular subject.
Please mute your mic.
So in Ayurveda, Acharya Shushruta has quoted in Sharistan chapter 3 that Tad Varshat Dvadashat Kale Vartmanam Ashruk Punaha Jara Pakva Shariranam Yati Panchashatakshayam. Factors for Rajonivruti, either premature or normal, that is Kal, Swabhav, Vayu, Karma, Dhatukshay, and Abhigatash. Types of Rajonivruti. Acharya Shushruta has further said that Swabhavika stu Shud Pipasa Jara Mrityu Nidra Prakrutayah Prakruti Gruhanat Prakruti Bhavarogaha Gruhyante Te च कदाचित स्वाभाविकाः कदाचित दोषजाः. एक स्वाभाविक होता है और एक दोषज होता है, जिसको हम प्रीमेच्योर और अर्ली मेनोपॉज बोलते हैं. स्वाभाविक को बोलते हैं नॉर्मल मेनोपॉज, जो नॉर्मल एज में होता है. So Rajonivrutti also can be divided into two types, Kalaj and Akalaj. Kalaj Rajonivrutti takes place probable age around 50 years, while Akalaj either before or after. Symptoms are very acute and medical attention is required to avoid its hazardous effects. So, early menopause in Ayurveda. According to Ayurveda, menopause is the stage of transition from Pitta-dominated phase of life to the Vata-dominated phase. That's why during the menopausal years, one naturally becomes prone to health symptoms related to Vata imbalance and Pitta imbalance. Such severe changes in her hormone levels and dosha balance poorly affect her metabolism as well. That's why some women may experience kapha imbalance symptoms such as excess weight gain, depression, and high cholesterol. Lakshanas of Rajonivrutti. These are the doshad lakshanas. In our textbooks, Vatas, Pittaj and Kaphad lakshanas are there, particular in Vatas lakshanas. जो हमें पेशेंट्स को देखने को मिलते हैं वो है शिरःशूल, आधमान, आटोप और अनिद्रा. In Pittad lakshanas, we have found Ushna Anubhuti, Yoni Dah, Glani, Svedadhikya. In Kaphad lakshanas, there is Rud Dhruvatva and Angamard. These are the Dhatuk Shad lakshanas. We all know that. This is Mansik lakshanas. Krodh, Shok, Bhaya, Dvesh, Smruti, Hash, Vishad, Chinta, etc. This is important. How we can correlate the Vata symptoms to modern symptomatology. So Vata symptoms represents as precordial pain, hypertension, restlessness, backache and fear, depression. While Pitta symptoms represents as hot flushes, sweating, irritability, anger, night sweats, pruritus vulva and bleeding disorders. While Kapha symptoms represents as obesity, sleepiness, oedema in joints, lack of motivation, feeling heaviness and lethargic conditions. So what should be the probable samprapti of Rajonivrutti? How we can break these samprapti? जब हम संप्राप्ति को अच्छे से लर्न करेंगे तब हम आगे जाके उसको ब्रेक डाउन कर पाएंगे, राइट? सो भाव प्रकाश हैज मेंशन्ड दैट वार्धक्य वर्धमानेन वायुनाम रस शोषणात् न तथा धातु वृद्धिश्या ततस्त्रात् अनिलम जयेत. This dominant vata dosh will have effect all over the female body, including all anatomical as well as physiological factors by virtue of its characters. It is laguta and rukshta. So considering these all points, the probable samprapti can be drawn under two main headings, kalat samprapti and akalat samprapti. In here we can show that kalat samprapti may takes place as biological stimulation. Due to that, it affects kala, vayu, swabhav and jaravastha, so that it can lead to dhatu kshayavastha, so that vata and pitta increases and kapha diminishes. So rasa rakta kshaya takes place, upadhatu kshaya takes place, and due to that artavaha srotasang happens, which can lead to rajonivruti. What happens in akalaj rajonivruti? Due to akalaj rajonivruti, karma affects and directly lead to the dhatu kshayavastha, and further samprapti remains same as per shown in the slide. While in abhikat adi rajonivruti, जो ट्रॉमेटिक फैक्टर्स होते हैं वो डायरेक्टली लीड टू द आर्तवह स्रोतसंग एंड इट कैन लीड टू रजोनिवृत्ति. संप्राप्ति घटक हम जानते ही ले, लेकिन अपन वायु को ट्रीट करना इधर विथ पित्त एंड कफ दोष. सो व्हाट शुड बी द आयुर्वेदिक मैनेजमेंट? कालस्य परिणामेन जरा मृत्यु निमित्तजा रोगाः स्वाभाविका दृष्टाः स्वभावो निश प्रतिक्रियः, which has been mentioned by Acharya Charak in Charistan chapter 1. जो भी कालज है वो स्वाभाविक है, उसका ट्रीटमेंट नहीं है, लेकिन जो अकालज है उसका ट्रीटमेंट है. और वो क्या है जो मैंने नीचे दिखाया है, वन एंड ओनली, दैट इज रसायन. रसायन तंत्र नाम वयस्थापनम आयुर्वेदा बलकरम रोगापहरणम समर्थम च. साथ में दिनचर्या, प्रॉपर ऋतुचर्या, yoga, pranayam, as well as panchakarma therapy. So the management and prevention of early menopause in Ayurveda includes proper ahar, food, proper vihar in the sense of lifestyle, proper aushadhi, medications, as well as karma, treatment. Ayurvedic treatment and natural remedies focus on strengthening and rejuvenating the reproductive system. So to avoid early aging, there is main the three principles. First one is to give rasan and vajikar therapy. Second one is nidan parivarjan. Third one is rehabilitation. Rasan action at the level of radiation damage. As an antioxidant, we have the drugs like ashwagandha, amalki, pipali. To DNA repair, we have excellent drugs like shatavari and sariva. For cellular viability, that is ashwagandha. To immunomodulators, that are guduchi, amalki, etc. Of course, suvarna bhasma. Rasayan effect, we know very well. Labhopayohishastanam rasadinam rasayanam. Improves nutrition, digestion, metabolism, and microcirculation. Leads to longevity, intelligence, fleshiness, and effectiveness. So, after seeing all these factors, these are the main principal drugs which I am using in my patients. That is ashwagandha, shatavari, turmeric, and amla. Why ashwagandha? Because it is a powerful adaptogen. It helps the body to manage stress. Its potential benefits in promoting sound sleep and maintaining hormonal balance. While shatavari is known as queen of herbs, as it also helps to balance the female hormones, thus easing menopausal symptoms like hot flushes and mood swings. What turmeric is doing, turmeric having the active compound curcumin is known for its anti-inflammatory properties. So it is best for joint pains and inflammation. And amla, as we all know that it is the best antioxidant and Indian grocery. It can also help in maintaining hormonal balance and boosting overall vitality. This is the drug, Ashokarist. Why it is important? How it helps? It contains several herbs like first Ashok, Sunthi, Haritaki, Vasa, and Chandan, which are Hrudya and Balya, can lead to direct Rasayan karma and Samprapti Vigatan happens and Rajonivruti Lakshan of Shamanam is there. While Haritaki, Amalki, and Utpal directly work as Rasayan karma, while Musta, Ajaji, Sunthi, and Haritaki are Dipan and Pachan, so it does Agni Pradipti and Prashasta Dhatu Nirman takes place, so it can lead to Dhatu Pushti and further Samprapti Vigatan happens. While Utpal, Haritaki, and Bibhitaki are Medhya, Manas Tarpan and Indriya Tarpan, so Chinta and shock is diminished and sleep disturbance is also go away, and thus it helps in breakdown of the Samprapti of Rajonivruti. These are the doshik effect of Ashokarish. In short, it is Vata, Pitta, and Kapha Shamak, matlab Tridosh Shamak. Further, most gem is Ashwagandha. Why it is important in this condition? Because it is having the property of Balya, Vayasthapan, Manas Tarpan, as well Vajikaran. Due to Balya and Vayasthapan properties, it is doing Rasayan Karma, Dhatu Pushti, and breakdown of Samprapti. Due to Manas Tarpan, because of alcohol, alkaloids, and glucosides inside, it supports sound sleep and anti-stress effect. आपके पास कोई भी पेशेंट आता हो जिसको भी नींद नहीं आती है या हार्मोन इम्बैलेंस है या स्ट्रेस है या एंजाइटी है, सिर्फ प्योर अश्वगंधा एक्सट्रैक्ट दे दो या अश्वगंधा टेबलेट प्योर, उसको डेफिनेटली रिजल्ट मिलेगा 100%. Now the last portion is Vajikaran effect. It nourishes the reproductive system, improve the sexual dysfunction. In short, Ashwagandha improve the degenerative changes by effect on chondroplasts in cartilage, hemopoietic effect by cyclophosphamide and reduces leukopenia. Another important drug that is Pravalpishti. Why it is important? Better and early result by using herbal calcium along with herbal phytoestrogen, and as a part of herbal calcium, Pravalpishti is used. In the body where Pitta is having Ushnata, Amlata, and likewise properties, Praval is also showing a soothing or cooling effect. So, what should be our Ayurvedic diet for early menopause? Of course, diet includes phytoestrogen and Vatahara diet. In short, increase the intake of warm foods and drinks. All these are balancing for Vata dosha. Maintain regular meals and follow scheduled timings. Avoid excess salt, chilies, spices. Reduce the use of caffeines, outside foods, sugars. Stop consuming junk foods. Avoid untimely meals, multiple meals, late night foods and snacks, and stop the consumption of processed foods as well packaged foods. We should not forget this calcium, which is helping to regulate hormones. Either it is early or regular menopause. And these are the calcium rich foods. We all know that. This is important. Magnesium. Magnesium rich foods are whole grains, leafy greens, dairy products, nuts, seaweed, and bananas. It is also the best which regulates the hypothalamo-pituitary ovarian axis. We should also maintain B12 and vitamin D deficiency. Why? Sufficiency. Vitamin D is an essential nutrient that supports your bones, hormone balance, and heart health. With aging, vitamin D production in the body goes down. That's why majority of the menopausal women struggle with vitamin D deficiency. जैसे FSH and LH राइज होता है, इस्ट्रोजन जैसे ही बढ़ना जो नॉर्मल लेवल होता है उससे कम होता जा रहा है बॉडी के अंदर, उसके साथ साथ कैल्शियम डेफिशिएंट होता है. जैसे कैल्शियम लॉस होता है. हेलो, यस, जैसे कैल्शियम बॉडी में लॉस होता है, इट कैन डायरेक्टली अफेक्ट टू विटामिन डी. जल्दी से बॉडी से बोन से एब्जॉर्ब होता है और बॉडी एकदम लिथार्जिक और बॉडी एक होने लगता है. Of course, take in healthy fats. Healthy fats promote heart health, strong immunity, and brain power. Several studies indicate that omega-3 foods can reduce physiological distress, anxiety, and mood swings. These are the phytoestrogen-rich foods we can also include in our diet, like apples, cashews, dry fruits, garlic, cranberries, and strawberries, etc. Phytoestrogens will help to balance the subsiding estrogen levels. Thus, they will support hormone balance and prevent low estrogen levels. So, how should be the lifestyle? Surviving and thriving through early menopause requires a combination of good healthcare, a supportive network, and proactive management of well-being. We can advise the patient to stay hydrated forever, to quit smoking, to cool down with mind, with full relaxation, and to take proper sleep. This is the important. This I'm calling the best ornament in our Ayurveda to cure, first of all, any degenerative changes, any autoimmune conditions, any hormonal conditions. Panchakarma. Management of this condition, Panchakarma. First, let's focus in Virachan. As we know that Snehan and Swedan are the part of Virachan. Snehan are effective in Vata Prakop. Snehan Dravyas are Sukshma, Sara, Snigdha, Mrudu, Guru properties, so it eliminates Vata dosha. While Swedan Dravya possesses properties which are opposite to the Vata dosha, it opens the srotas and regulates the blood circulation. And Virachan drugs are Kosthagni drugs which quickly absorb through the microchannels and results in Vishyandan of Sang dosh, Vichandan, breakdown of the dosh and mal. By its Anupravan Bhavat, and it has Adobhaga Prabhavit, remove dosha or maintain Samvat Avastha of dosha. Now coming to Basti, there are the three types of Basti: Asthapan Basti, Yog Basti, in that Asthapan Basti, Anuvasan Basti, and Uttar Basti. The ovarian cycle is regulated through the feedback of hormones on the neural tissue of CNS. The regulation of ovarian function occurs through hypothalamo-pituitary ovarian axis by autocrine, paracrine, and endocrine mechanisms. Hypothalamus and pituitary are under control of CNS, while ovaries under control of parasympathetic nervous system. Intestine is richly supplied with nerves, Hence, the theory of ENS emerges out. ENS to CNS. We all know that enteric nervous system is called as second brain of our body. Why? Because it is having the 500 million neurons where we are giving basti and it gets absorbed and stimulate further CNS and neurotransmitters and parasympathetic activities. Basti stimulate the ENS, generates the stimulatory signals for CNS, causes stimulation of hypothalamus for GnRH and the pituitary for FSH and LH with the help of neurotransmitters. Basti given through rectum will stimulate this parasympathetic nervous supply also, which in turn helps for the release of ovum from the follicle in the ovary. How? What is the role of endogenous opioids? It has a relation with Anuvasan Basti. These are a group of peptides which play an important role in ovarian cycle through the inhibitory effect of GnRH secretion. Other pituitary hormones are also modulated by opiates. Endorphin stands for endogenous morphine. Beta endorphin has been best known of the opioid related to the reproductive system, regulating variety of pituitary hormones, including gonadotrophins. So beta endorphin has a role in the regulation of the normal ovarian cycle. Anuvasan Basti, through rectum, fast absorption reaches in the systemic circulation, which stimulates the GIT and enteric nervous system, which stimulates endogenous opioids, and influence of GnRH release takes place, which regulates the HPO axis and it regulates the ovarian cycle as well. इस तरह से अनुवासन बस्ती और दिस opioids, endogenous opioids का भी एक यूनिक कनेक्शन है पर्टिकुलर टू रिलीज द ओवम, टू रप्चर द ओवम. Now coming to the Uttar Basti, we all know that Uttar intravaginal, intrauterine Uttar Basti helps in removing the infections. Intrauterine Uttar Basti may also facilitate the absorption of drug as posterior fornix has a very rich blood supply. Intracervical Uttar Basti with oil-based drug helps to remove the cervical stenosis and to restore the function of cervix, is conception and helps to treat dysmenorrhea caused by this stenosis. Yes, that is important. Intracervical Uttar Basti with Bruhan drugs like ghee and tel may stimulate the secretion of cervical mucus, leading to ascent of sperms in the uterine cavity. Intrauterine Uttar Basti with Greek-based Snehan and Brihan drugs helps in rejuvenation of endometrium, especially where apart from regular ovulation, poor endometrium is causing infertility or scanty menstruation. In cases of menorrhagia due to hyperplastic endometrium, intrauterine Uttar Basti with Lekhan Dravyas may help. For tubal factor also, a high intrauterine Uttar Basti with Lekhan Dravyas acts. We should not forget that nasya, hypothalamus and anterior pituitary plays major role in the regulation of genital organ hormones. Both have their anatomical position in head. Hypothalamus is also responsible for the vasomotor changes in the body, which is functional area of nasya. And Takradhara, it is having cooling properties and induces the same effect on the body and mind. It reduces stress, improves mental health, improves skin and hair quality. It is believed to have a balancing effect on the deepest recess of our brain, stimulating the endocrine system, the pituitary and pineal gland, enhance pleasure neurotransmitters. It is also said to enhance blood circulation. So, in Ayurvedic text, no direct reference is available for early menopause or premature ovarian failure. But Acharya Shushruta has mentioned Sarvanga Dhatu Kshaya Rajo Nivruti Esh. In concept of Tri Shukra Dhatu, ovarian hormones can be correlated with Antah Shukra. Raja Nirman is done by Ras Dhatu, and all the Dhatu portion occurs in Uttaro Uttar Karma. As this disease is Vata predominant, which is shown by hot flushes, night sweats, insomnia, vaginal dryness, etc. So treatment should be planned to elimination of Vata dosha or nourishes Ras Dhatu and also normalize Pitta. Virachan and Bhakti is proved of its highly beneficial effect. Nasya and Takradhara is also advised to improve psychological as changes as well hair and skin textures. Panchakarma procedure, Snehan, Swedan, Virachan, Niru Basti, Uttar Basti, Nasya and Takradhara along with oral Ayurvedic medications are effective and safe treatment modality for the elevation of symptoms related to premature ovarian conditions in women. ये मेरा केस स्टडी है. ये खुद मॉडर्न एलोपैथिक हॉस्पिटल्स में सिस्टर है और वो करीब 1.5 साल से मेरी पेशेंट है. अभी भी उसका ट्रीटमेंट चालू है. पेशेंट इज गॉन अंडर माय ट्रीटमेंट. शी इज हैविंग सेम totally secondary amenorrhea and the same early menopausal conditions. And I have given, this is her IPD case paper, I have admitted this patient. I have given her Virachan treatment, repeatedly Lekhan Bastis for 3 to 4 times and Uttar Basti for minimum at least 2 to 3 times. And you can see here the result of that. This is the February 2023 result. FSH was 47 and LH was 12. While in now, May month, FSH is reduced. You can see here 29 and LH is 12. See, this is 47, which is reduced to 29. And this is 12, which remains same. 12, it is normal actually. Her prolactin level is also normal. This is my miracle रिजल्ट इन दिस पेशेंट. इसको मैंने पंचकर्म करने के बाद में मैंने रसायन थेरापी पे चालू रखा है. अभी जैसे मैंने दिया है वात अनुलोमन ट्रीटमेंट एंड रसायन ट्रीटमेंट, उसके अंदर मैंने डाला है अश्वगंधा चूर्ण, प्रवाल पिष्टि, जैसे कि मैंने पहले स्लाइड्स में दिखाया है. उसके साथ में शतावरी एंड शतपुष्पा नाग केसर का कॉम्बिनेशन में देती हूँ विथ हनी. आर्तवजनक है वो. साथ में मैंने चंद्रप्रभावटी भी ऐड किया है. मैं ऑल्टरनेट रखती हूँ श्री रसायन वटी और चंद्रप्रभावटी. दशमूल काढ़ा में देख के रखती हूँ वात अनुलोमन करने के लिए. मैं परगेटिव दिया है मैंने पेशेंट को स्वादिष्ट विरेचन चूर्ण एंड त्रिफला चूर्ण का कॉम्बिनेशन लाइक दैट. दिस इज द लाइन ऑफ ट्रीटमेंट ऑफ माइन. एंड दिस इज माई सेकंड पेशेंट. ये जो पेशेंट है, हाँ मैं एक चीज बोलना रह गया इसमें कि ये अभी रिपोर्ट है मेरे पास फेब्रुआरी का. जब पेशेंट मेरे पास फर्स्ट टाइम आया था बिफोर 6 मंथ, तब वो 100 के ऊपर था. उसका जो एफएसएच था वो मोर देन 130 था और एलएच था वो भी मोर देन अराउंड 90 या 80 था. वो रिपोर्ट अनफॉर्चुनेटली मेरे पास नहीं है. आई कुडंट अटैच हियर, बट I have shown here from February to May month reports. And this is the another patient, Janki Patel, and she is undergoing my treatment. And this is her level. FSH is 105 and LH is 50. And this is her case paper. Her treatment is going on actually right now. I have planned the same. As patient is not fit for Vamana Karma, so I have started with Virachana Karma with repeatedly Lekhan Bastis and Uttar Bastis. And I am waiting for positive results. जैसे ही होता है मैं आप सबके साथ शेयर करूंगी. These 2 results I have, and of course I have got magical results in these conditions, so I have shared with you. Thank you. It brings the end to this presentation, of course.
Thank you so much, ma'am, for this wonderful session. Your experiences, your perspective about menopause, drugs, doshas, panchakarma, all these are very informative for us, ma'am. From this
Yes.
session, we have gained a better and different point of view, ma'am. Ayurveda has great scope.
Any
Hello.
question from participants? Ma'am, kindly explain the treatment part again.
ट्रीटमेंट पार्क, ट्रीटमेंट में कैसा है, शोधन से हम शुरू करते हैं. फर्स्ट ऑफ ऑल हार्मोन्स को रेगुलेट करने स्टार्टिंग ट्रीटमेंट विथ चक्रधारा. आफ्टर कंप्लीटिंग चक्रधारा I will start to shodhan from as a part of Virachan Karma. After completing Virachan Karma, there may be the sessions of Lekhan Basti. In Lekhan Basti, आपको मैं बता रही हूँ कि आई एम यूजिंग गौमूत्र वाला लेखन बस्ती, जिसमें त्रिफलाक वात में डालती हूँ स्पेशली. और उसके बाद में मैं उत्तर बस्ती यूज करती हूँ. उत्तर बस्ती के अंदर मैं पर्टिकुलर फलग्रीत पहले 2 साइकिल में यूज करती हूँ. उसके बाद में मैं डायरेक्टली जाती हूँ शतपुष्पा ऑयल. मेरा शतपुष्पा पे ज्यादा वर्क है. अभी रिसेंटली मैंने एक ऐसा 8 इयर्स पुराना पीसी पेशेंट कंसीव किया है.
Thank you, ma'am. What kind treatment should advise patient at postmenopausal phase having same symptoms? Hello,
हाँ, yes.
ma'am. The next question is, sorry. What kind of treatment should advise to patient
Hello?
at postmenopausal phase having same symptoms?
In postmenopausal phase,
Yes, ma'am. Yes.
treatment will be same. Treatment
Okay.
will be same. मैं तक्रधारा से शुरू करती हूँ. If you cannot do तक्रधारा, then do simple warm water शिरोधारा and focus on basti. If patient
Okay.
is in postmenopausal condition and she is in old age, then directly you can start with basti therapy, particular anuvasan basti. If she is not able to catch asthapan bastis, etc., then do anuvasan bastis. I am using Dhanvantaram oil in 90 ml of doses in particular postmenopausal conditions to cure the postmenopausal osteoporosis conditions, because these type of patients are having the complaints of joint pains and calcium loss, palpitations, perspiration, etc. And it is giving fantastic results to me. Of course, in cases of cystitis and frequent micturition, in that condition also it is giving best. So I'm line of treatment should be anuvasan basti, oiling, body के अंदर oiling करना है हमें.
Yes, ma'am. Thank you, ma'am. The next question is, why Lekhan Basti is used in this condition? Hello? Ma'am, can you hear me?
Hello?
Ma'am, why Lekhan Basti is used in this condition? Our next question is, why Lekhan
लेखन
Basti
बस्ती
is used?
मैंने बोला.
Yes, yes.
या लेखन बस्ती में आर्तव जनन जो हार्मोन एचपीओ एक्सिस को बैलेंस करने के लिए मैं यूज करती हूँ, क्योंकि जो स्ट्रॉन्गेस्ट होता है, जिससे हम ट्रेन को चलाने के लिए इंजन के बिना ट्रेन के डब्बे नहीं हिलेंगे इन वेरी शॉर्ट टर्म. I just want to explain in that like that जैसे ही उसको एक बार जनरेट होता है, जैसे इंजन बॉडी के अंदर, वो गौमूत्र के बिना नहीं होगा. शरीर में कुछ भी आप कर लो, कितना भी आप रज प्रवर्तनी बटी दे दो, कन्या लोहादी बटी दे दो, या फिर कोई भी वात शामक ड्रग दे दो, लेकिन ये गौमूत्र वाला जो भी लेखन बस्ती है, यदि होएगा तो इससे ही होएगा. दैट इज फॉर श्योर. और दैट्स व्हाई आई एम गिविंग स्ट्रॉन्गेस्ट लेखन बस्ती, ऐसा भी नहीं कि माइल्ड। पेशेंट को मिनिमम 4 to 5 टाइम्स बस्ती देने के बाद में मोशन भी होना चाहिए।
Okay, thank you, ma'am.
Yeah.
Our next question is from Dr. Manjusha Karkare, ma'am. We see reduced blood flow in young women. Can it be an early manifestation of probable early menopause? What is the best way to treat such hypomenorrhea?
Pardon me, मैं समझी नहीं। Hypomenorrhea, menstrual irregularities.
My question is, generally in young women we are seeing the reduced blood flow. So can it be an early manifestation of probably early menopause?
Yes.
Okay, and what are the best way to treat such hypomenorrhea cases?
चंद्रप्रभावटी, शतावरी चूर्ण, गिव एस्ट्रोजेंस, फाइटोएस्ट्रोजेंस, जैसे मैंने बताया स्लाइड्स में आगे, दशमूल कषाय, चित्रकादिवटी ऑफ कोर्स। उसको हमें आर्तवजनक दवाई नहीं देनी है, बट एज के रिगार्डिंग जो भी हार्मोन होने चाहिए उसको में कंटिन्यू करते हैं, तो उसके अंदर चंद्रप्रभावटी देते हैं और शतावरी चूर्ण। दीज टू आर द मेन लाइन ऑफ ट्रीटमेंट इन सच टाइप ऑफ केसेस। पेरीमेनोपॉजल एज जिसको बोलते हैं।
Yes, ma'am. Okay.
Yes.
Thank you very much, ma'am.
Yeah.
My other question is, Ashok, specifically Ashok churna or Ashok any preparation, which should in which type of cases? Ashok is already said to be a immunogo, and vice versa, it is working as a samban also. Though in which cases we should use Ashok particularly?
अशोक मैंने बोला ना रसायन करने के लिए, ऐसा अशोक का रोल ऐसे नहीं है कि वो कषाय ही करेगा, वो स्तंभन ही करेगा, बट एज ए रसायन वी कैन यूज, बट नॉट लाइक हियर आई एम यूजिंग अशोक आरिष्ट, नॉट अशोक विथ हनी और तंडुलोदक टू स्टॉप एनी श्वेत प्रदर, और जैसे आयुर्वेद में बोला है ना अनुपान का इंपॉर्टेंट रोल है, इस तरह से मैं यूज करती हूँ। अशोक आरिष्ट जो हमारे वॉल्यूम्स में दिए गए हैं एपीआई में, उसके अकॉर्डिंग में वो नागार्जुना या सांडू का अशोकारिष्ट यूज करती हूँ। जैसे पेशेंट्स को मेरे को लगे ज्यादा एंजाइटी में है, ज्यादा स्ट्रेस में है, तो उसको मैं देख के रखती हूँ कि उसको अच्छे से नींद भी आ जाए, अरिष्ट है। बाकी अशोकलोद्र पुष्यानुपला कॉम्बिनेशन नहीं देना है इसमें कि वो डायरेक्टली तंडुलोदक के साथ देने से वो स्तंभन कर दे, ब्लीडिंग डिसऑर्डर्स में जैसे हम इंडिकेट करते हैं, ऐसा नहीं है इसमें। सो आई एम यूजिंग अशोकारिष्ट इन शॉर्ट।
Okay, thank you very much, ma'am.
Yes.
Ma'am, one more question is, do you consider Uttar Basti as a always intrauterine?
Of course. Uttar Basti is one and only in intrauterine conditions. I am not labeled Uttar Basti in intravaginal. वो स्लाइड में रखा था, वो सिर्फ एक्सप्लेनेशन के लिए मैंने रखा था, लेकिन आई एम डूइंग इन ओटी विद ऑल ऑटोक्लेव एंड स्टेराइल कंडीशंस, एंड पेशेंट को मैं इंट्रा यूटेराइन ही करती हूँ। और दूसरा चीज एक इम्पोर्टेंट इसके साथ में मैं बताती हूँ कि ऐसे पेशेंट होते हैं जिसमें प्राइमरी और सेकेंडरी एमेनोरिया वाले होते, तो उसके अंदर जो सर्वाइकल ओस होता है ना, वो भी ऑब्स्ट्रक्ट हो जाता है, स्टेनोस्ट हो जाता है, तो उसमें डायलेट करना पड़ता है, बहुत मेहनत करनी पड़ती है कि वो डायलेटर से पहले हम ओस को डायलेट करते हैं, फिर जाके उत्तर बस्ती होता है और फिर उसका रिजल्ट मिलता है। इंट्राविजाइनल बस्ती से इसका कोई लेना देना नहीं है।
Okay, ma'am.
How
And
much
how much?
quantity? Yes. 5 ml. Actually, the capacity of uterus is 2 ml. So it absorbs as much 2 ml जितना होता है, बाकी का वो बाहर निकलता है, लेकिन वी आर गिविंग 5 ml। और मैंने पहले भी बताया कि फर्स्ट एंजिन को शुरू करने के लिए मैं फलग्रीत देती हूँ, और जैसे ही उसका मासिक एक बार आ गया उसके बाद में मैं शतपुष्पा तेल में उसको कन्वर्ट कर देती हूँ पूरा। मतलब मैं बस्ती में भी शतपुष्पादी ऑयल यूज करती हूँ और उत्तर बस्ती में भी 5 ml शतपुष्पादी ऑयल में डालती हूँ, इस तरह से रहता है। तो इससे क्या होता है कि 2 साइकिल के बीच का जो भी समय है वो भी कम होगा और उसका साइकिल भी रेगुलेट होगा। और ये मैं बात कर रही हूँ विदाउट मॉडर्न और एलोपैथिक सपोर्ट, ओनली विथ आयुर्वेदा।
Yes, ma'am, definitely.
Yeah.
One more question is, ma'am, what are the grutha or a tela that can be used as a snake pana for the cases of POF, premature ovarian failure, particularly
Yeah.
Panchakarma? Yes, ma'am.
Shatavari growth, of course.
Okay, ma'am.
Shatavari growth, of course, you can use Falagrit if there is infertility issue also there, but I'm using only Shatavari growth. क्योंकि पेशेंट बहुत हमारे पास साइकोलॉजिकल डिस्टर्बेंस के साथ आता है, उनको हम ऐसे पंचगव्य घृत भी दे सकते हैं, लेकिन वो सब वो ले ही नहीं पाएंगे. सो वो सब कंडीशन ध्यान में रख के यस आई एम यूजिंग आइदर शतावरी घृत और सिंपल गाय का घी, बस दो ही मैं यूज करती हूँ.
One more question is, have you tried other form of medicines than Sneha? I think for Uttar Basti, she's asking for you.
Pardon me, नहीं समझ में आया.
Ma'am, you have told about that you are using first Palagrut and then
Yes.
Shatpushpa Tela for Uttar Basti. She
Yes.
is asking that have you tried other form of medicines that than Sneha?
In Uttar Basti?
Yes, ma'am. Like Quatha
हाँ, of
or
course. नहीं 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 नहीं, क्वाथ नहीं देते हैं. तेल में हमने नारायण तेल यूज किया है पहले, लेकिन उसका एंडोमेट्रियम हम उत्तर बस्ती क्यों करते हैं? टू इंक्रीज एंडोमेट्रियल थिकनेस, राइट? और वो फलग्रीत बेस्ट रिजल्ट देता है. एक बार फलग्रीत से ईटी हम आ जाए, ईटी मेंटेन हो जाए अप टू 7 to 8 जो हमें चाहिए एक्चुअली फर्टिलिटी के लिए, फर्टाइल वुमन के लिए, उसके बाद में फिर हम उसको मेंटेन रखने के लिए शतपुष्पाद्य तेल यूज करते हैं. बाकी डिकॉक्शन से नहीं किया है और करना भी करते नहीं है एक्चुअली.
Yes, ma'am. Thank you, ma'am.
Yes.
Okay. There is a no question now. Thank you very much, ma'am, for the wonderful session. You have explained the premature menopause from the modern and Ayurveda point of view in detail.
Yes.
On behalf of NIMA OBGY Society Central and NIMA OBGY Society Maharashtra body, I would like to express my gratitude to NIMA Central President Dr. Ashutosh Kulkarni sir and Secretary Dr. U.S. Pandey sir for the remarkable support. I extend my gratitude to our NIMA OBGY Central President Dr. Kamini Dhiman Madam, Secretary Dr. Priyanka Nakade Madam, Treasurer Dr. Vishnu Bhavne sir, and Convener Dr. Rajesh Uthane for supporting and guiding us to conduct today's webinar. I would also like to thank and extend my gratitude to our eminent speaker, Dr. Mansi Modi Madam, who took time from the busy schedule and delivered very knowledgeable and wonderful session. I would further like to extend my gratitude to our NIMA OBGYN Maharashtra President Dr. Suhas Halkar sir, Secretary Dr. Manoj Gaikwad sir, Treasurer Dr. Ayajrat Bal sir for all their support to conduct today's webinar. I would also like to thank Dr. Girish Daga sir and Dr. Archana Pandey ma'am for all the help and technical support. Last but not least, I would like to thank from bottom of my heart to all the delegates for their participation and presence. Without them, this webinar would not have been possible and succeeded. Now, with the due permission of all the dignitaries, I am concluding today's webinar. Thank you all for the attending and hope you have learned and gained great knowledge from today's speaker. Thank you very much, all of you. Thank you very much, Mansi ma'am.
Thank you.
Thank you, Mansi ma'am. Thank you so much for such wonderful session. It was really very knowledgeable. Thank you for sharing your clinical experience and your treatment protocols also. It was real treat to hear you. Thank you so much, ma'am.
You are welcome always. Yes.